We then proceed to the symptoms of cataplexy, which is one of the signs for diagnosis of narcolepsy. I think I alluded to it earlier. So patients develop episodic muscle weakness with emotional stimulus. This usually happens since the childhood and may continue into their adult life. Circadian rhythm disorders, again, this is more commoner in younger adults and children rather than in the older age group. They usually complain of both insomnia and excessive daytime sleepiness. So they can't go to sleep or they wake up early, depending on whether it is a delayed phase or advanced phase circadian rhythm problem. And in the remaining time, they find that they are sleepy and they want to go to bed during the daytime. It is always important to get the collateral from the bed partner. So ask about snoring, because patient may not realize they are snoring, though they might complain of dry mouth in the mornings. Is there any sleep related movements? It could be like periodic limb movements, or it could be acting out the dreams. Is there any behavioral problems like talking in the sleep, walking in the sleep, any such symptoms or any behaviors which is abnormal during the sleep? It would be worth knowing from the sleep onset at what time these symptoms happen or these behaviors happen, and it is also important to know whether the patient can recall these events. It will help with the differential diagnosis. Past medical history always asks for any neurological conditions like Parkinson's disease, which could be related with restless leg syndromes or periodic limb movements of sleep. Dementia can cause depression, which can affect circadian rhythm problems. Painful conditions can cause insomnia. Ischemic heart disease, congestive cardiac failure, asthma, COPD, all these are exacerbated by obstructive sleep apnea. Migraine can mimic morning headaches. Neuropathy and diabetes can cause restless leg syndrome as well. These are the investigations we use for sleep related disorders. The most important one we use is the polysomnography, which could be a nocturnal polysomnography, or it could be a 24-hour polysomnography, which is rarely used, or it could be used for sleep breathing disorders titration of CPAP, or could be for BiPAP titration. MSLT means sleep latency test, and MWT is maintenance of wakefulness test. These are to check for excessive daytime sleepiness and how they affect the patient's day-to-day life.